Hi, my name's Laurel Jolliff, and I am the owner-manager of a company called Life Matters Insurance and Financial Solutions. I have been serving the foothills in Northern California for 17 plus years, and I love it here. This is my home, and we're super happy here. There's a lot of needs here, and I've found a place for me to help others, which is, of course, what everyone wants to do. So that's what I help people with. I'm licensed with life and health insurance, and so I focus on medical insurance, health insurance. I do annuities and life insurance as well. However, the Medicare market, if you will, is poorly underserved, in my opinion, and I have found that that's where I am best fit. And so I spend a large part of my year serving seniors with their health insurance needs. And so that's kind of what I do. One of your first questions was, any changes for 2026? And my answer is absolutely. Lots of changes. So let me go back a little bit in order for me to explain a couple of the big changes. So when someone gets Medicare, they can be, and I say on the left side of the page or the right side of the page, and that's on page 10 of your Medicare New Book this year for 2026. What that means is, on the left side of the page, there's original Medicare, A and B, and then you have a separate D, Part D, it's a drug plan, prescription plan, and then on the bottom of that left side of the page, you can get a Medigap plan or a Medicare Supplement plan. And that plan, so that covers what Medicare doesn't cover, depending on which level of coverage you get. Or you can be on the right side of that page, which again is page 10 of your Medicare New Book for 2026. That page is your Medicare Advantage Plan, or a Part C. That's the other name for that. So a Part C includes A and B. Of course, you still pay for B. Most of them include a D, so it includes a prescription plan. And then you have copays and deductibles and things like that on the Medicare Advantage Plan. There are positives and negatives on both sides of the page, if you will. A positive on the left side of the page, where you have the Medigap plan to go along with the Medicare, is they never change. As long as you keep paying it, you keep getting it. A positive in the left side of the page is you can go to any doctor you want in the country. If they take Medicare, they take you, outside of Kaiser doctors, okay? Another positive on that side of the page is you don't need any referrals. So there's no, see the primary care first, get a referral note to see a specialist. You can just go see the specialist. Now, there's a caveat to that. Some specialists want you to see the primary care first and get their blessing as to go to that specialist. So on the left side of the page, when you have a Medigap plan, you do not need that referral. If a physician requires it, then get one, but the insurance company does not require it. On the right side of the page, a positive would be their low cost compared to the supplements on the left side. The Medicare Advantage Plan has one usually low cost. In some counties, the plan is zero premium, and then you have copays when you go to the doctor. A positive on the right side of the page is most of them include some dental, vision, and hearing. A negative on the left side of the page, again, Medicare, Medigap. A negative on that side of the page is they're expensive. They can go up every year, once for your birthday, because they're priced based on age and your zip code. And they're also priced, they change every year when you have a birthday. So you get a letter that says, happy birthday, your new rate is, okay? So that's a birthday card, kind of. As well as they have an annual rate adjustment that they can implement. And so I share with everyone that I meet that these can go up twice a year, once for your birthday and once for their annual rate adjustment. A negative on the left side of the page is there is no dental, vision, hearing. And that's about it. A negative on the right side of the page, the Medicare Advantage Plan, is those plans can change every year, and they do. Their prices change, their benefits change, their copays change, their physicians network changes, and they can go away. And that's what they've done this next year in our area. So in this year, in 2025, we had 3 Medicare Advantage plans: Humana, Aetna, and Anthem Blue Cross. They're all PPOs. Next year, we have 1, which means over 500 people in our county alone, just Calaveras, are losing their health insurance. They had Aetna or Anthem Blue Cross PPO. They all got letters, some of which were just prior to October 1st, which was their the deadline by law. And I know that they're angry, they're confused, they're freaking out, they're upset, and it's my job to help find them, to give them some hope, to let them know what their options are for next year. Oftentimes, they're better than what they had.
So what's the one that's
Coverage-wise. The one that's left is Humana.
Really?
Yes.
I would have thought Anthem would have been the one that was left.
Now, I will say, it's not just Calaveras. Hundreds and hundreds of Medicare Advantage plans are leaving the counties nationwide. All different companies. United Healthcare, Anthem Blue Cross, Aetna, Humana is pulling back. And so many companies are terminating their Medicare Advantage plans for next year. And so the next question is why? Yes, go ahead.
I'm a certified coder, and when I was volunteering, because nobody was hiring, in Amador County 3 years ago, no physicians took Medicare Advantage because you get paid $3.
Oh my God.
I believe that very few physicians take the Medicare Advantage. However, as a PPO, they're supposed to, as out of network, but many did not.
Yeah.
You are correct.
I think Sutter now is, you have to, so if you go to their clinics, kind of thing. But my cousins that are lucky enough to have Kaiser PPO, Kaiser Advantage, they love it.
So Kaiser is an HMO,
Oh, sorry.
which means you have to go to those doctors only. Some people love Kaiser, some people hate it.
Yeah.
Kaiser's partial in Amador. It's not available at all in Calaveras or Tuolumne. And so, yeah, we are very limited compared to San Joaquin County, for example. So probably 15 years ago, there was a couple different Medicare Advantage plans here in Calaveras, not even in Tuolumne yet. And then they quickly went away after a ton of people got them. And then we went about 12 years with no Medicare Advantage plan. Only people got the supplement, the left side of the page, the Medigap plan. And they were quite happy, by the way. And then when the Medicare Advantage plan started coming to Calaveras, many were skeptical. Most did not take it, but many did, obviously. And now they see what happens. And I tell them, this can go away I say the exact same thing every single time. And they're shocked because they didn't, I tell them. Just like I just told you, that they can go away because they can change. And in 27, and one can be added. We don't know, but I know for sure 2026 only will have 1.
So if your Advantage plan got canceled, can you then go back to a regular plan during this period without any underwriting?
That's
Or
a
do you
great
have to wait
question.
until your birthday?
No, so that's a great question. So because, let's say you have an Aetna plan, the Aetna PPO here as a Medicare Advantage plan in Calaveras County, and Amador, I believe there's one there. They are guaranteed issue into a supplement. They actually have an extended time. Their deadline is not December 7th, but it's later on. However, there's a caveat to that, and I'll explain that in a sec. The good news is that regardless of their health, they're guaranteed issue into a supplement. The challenge is the supplements are limited. Most companies have a Plan F, a Plan G, a Plan N, some have a high deductible G. The F, if you had Medicare before 2020, or G are the only ones that are guaranteed issue. One company offers an N as a guaranteed issue as well, which is less expensive than the G or the F. Let's talk about the deadline a little bit. So a Medicare Advantage plan has, as I mentioned before, Medicare plus a drug plan. And if you go to a supplement guaranteed issue, and let's say it starts, I'll go the easy way. Let's say it starts January 1st. As long as you get your new drug plan before December 7th, you're fine. So you have until February 1st to get the supplement, but you only have until December 7th to get the drug plan for a January 1 effective. And so they're a little goofy in that. I highly recommend getting it situated before December 7th.
Okay.
I will say also that the Medicare.gov website crashes almost every day because of the volume of people on it. And so be patient. I have people who I'm now encouraging them, after we've done the research on their prescriptions, to find out which prescription plan is the best one for them for next year. I say, okay, it looks like you want to self-enroll into this particular plan, because I can't write them now, and I'll go over that in a sec. They're on hold for hours. And I'm like, well, it's October 15th, 16th, 17th. And so that'll get a little bit better, but expect it. Because for the last 17 years, I have written prescription plans. I and other agents across the country have written prescription plans for our folks and get paid a little bit for it. And there were lifetime commissions, and now they're gone. That's another big change for 2025, and then now all for 2026. And so I cannot write the application because I'm licensed. And so my E&O would not allow that. I have to be compensated in order to be able to write an application. So I tell a lot of people, go to healthspring.com, go to wellcare.com. After we've determined which plan is the best one, I will still do that for folks. Many agents won't, because we're not getting compensated for it at all. But I do it. My joke is because I like you. But I'll do it until I can't, you know.
So healthspring.com,
Wellcare.com. It depends on your prescriptions, though.
this is just for prescription?
Yeah. I mean, I would not recommend going there without going to Medicare.gov and putting in your prescriptions and where you want to buy them, and let it tell you of the 12 plans next year, which is the best one for you financially. If it says healthspring.com, or if it says HealthSpring Assurance, then go to that website or call the phone number on it, on the Medicare.gov website. Same with WellCare Value Script. WellCare has a few different plans. HealthSpring has a few different plans. We have people who were paying $20 for a Cigna Saver plan this year. That's going to $70 next year, a month. And so they're calling me. One plan went from 50 to 104. The prescription plans are nuts. In years past, the most expensive prescription plan was about $125. Now it's about $250 for a prescription plan.
A month.
A month.
Holy moly.
Yeah. And it's because of the expensive prescriptions they have.
Right. Thank
So
God.
again, I would 100% go to Medicare.gov, put in find plans, put in your zip code, put in your prescriptions, where you want to buy them, and be open to that. Go to, check Safeway, check CVS, check Walmart, check mail order, so you can get prices on all of it. And then you can make an educated decision. And then you can go to that website or make that phone call. Okay? But don't do anything until you do the research or have someone do it for you. Big change.
Now, as I recall, the first time I went on that website, I had a heck of a time.
Mhm.
Is it any, that would have been, I don't know, 4 years ago. Has
Mhm.
it gotten any easier?
No, not at
Okay.
all. Not at all. In fact, it was funny. I suggested to someone, okay, I want you to, So this is a plan that's best for you. Here's the website, go sign up. And she called me and said, which one do I do? I'm not finding it because, it's confusing.
Right.
There's Medicare Advantage plans there, there's prescription drug plans, there's 2025, there's 2026, and of course I do it without thinking because I do it 100 times a day, but I can't do it for them.
That's unconscionable.
Yeah.
Because the consequences are huge.
They are, because you can't change your plan until next year.
Yeah.
Yeah.
And you're financially strapped.
Not only that, but if you get a Medicare Advantage plan, here that's not so easy because there aren't any, but it's going to tell you, no, you can't, and then you're going to go, she told me I could, because we got the wrong tab
Right.
on the website. Yeah, they've, now, so let's talk about why. I believe, and many agents believe in the country, believe that the Medicare Advantage plans are consolidating and going away a little bit, and they're reevaluating because they are trying to get rid of us brokers because we're expensive in the big picture of things. And so they say, just like, well, Covered California, you can go online and do it yourself, which is a mess. Major confusion there. It's even worse than Medicare, frankly. But they're trying to, okay, so now you're with WellCare. Well, now WellCare has permission to call you and to insist, well, I should say, to encourage you to get a WellCare Medicare Advantage plan. Because that's where that's where the bigwigs want you, the Medicare Advantage plans, ultimately. So they're paring back, getting rid of us brokers, and then having permission to call you to say, let's get that Medicare Advantage plan. You can do this and this and this and this and this. And they will say, and you can keep your doctor and all that, which is not true for many cases, especially up here. And so, yeah, then you're stuck with it for a year, and you may not be able to go back. So that's kind of a big deal. But I do believe that that's the long-term plan for them. Now, do I have a crystal ball? No. But that's our educated guess.
Does that mean the straight supplement plans are gonna go away then? At some
Well,
point?
I'm thinking that that's what they would like because frankly they pay more they pay more for your health health bills through that supplement. That might be 10, 20 years from now. We won't care by then.
We've got another 36 years.
You know,
I'm concerned
Yeah,
about.
so most physicians and nurses and providers will say, don't get a Medicare Advantage plan. Because let's talk about any procedure. So if you're on the left side of the page, you have original Medicare and you have a supplement. Medicare determines whether or not something is covered. The supplement follows. They don't think, they follow. And so if Medicare says, okay, you can have that procedure, the supplement follows. With a Medicare Advantage plan, Medicare pays that Advantage plan to take care of you. They are the ones who determine yes or no on that test or that procedure. And so Medicare doesn't do the thinking. The Medicare Advantage, the company does. The Humana, the Anthem Blue Cross, the Aetna, they're the ones that do the thinking and decision making for that particular test, which is one reason why providers don't prefer them, because they'll say no, or they'll, as someone mentioned earlier, that they pay the physicians a lot less.
Yeah, I know that when I had my foot surgery done last year, that was one of the comments my surgeon made was, he asked me what insurance I had. I told him United, AARP, and he went, oh good, then we don't need to get a recommendation or a
Referral.
thank you.
Mm-hmm.
So it really made the procedure a lot easier.
It does. It does.
everything. And then, yeah, I paid nothing
Mhm.
basically until the follow-ups in the following year, but it was okay because I always end up paying that deductible anyway, so
Right.
it really didn't matter.
Right.
I do have to say, I was completely disgusted. They disallowed a $39 boot that I wore. I paid it anyway, even though I know I'm not obligated to, because it was just ridiculous. What did they think I was gonna do, hop out of the office? You know?
Well, that's a durable medical equipment supply, it's a supply, and that's not covered under Part B as in boy,
Okay,
and you have a $257 deductible. Had you already paid that deductible, you wouldn't have paid anything for it.
okay.
So it's all together, doctor visits, a lot of other things that are under Part B, including the durable medical equipment.
All right.
So if that deductible had been paid, you wouldn't have paid anything.
But
If that helps.
they just allowed the claimant altogether. They didn't say we paid 0 and you need to pay X. They said we will not pay for this, is not authorized,
Wow,
which I thought was ridiculous. And
that's,
I paid it.
what do you
because
suggest?
It's ridiculous, and it was $40. I
Yeah.
wasn't gonna stiff them out of $40.
Yeah, yeah,
you know?
yeah,
So,
yeah.
anyway.
So here's another question a lot of people have. In fact, I met with a gentleman before church Sunday morning because he doesn't drive, and so I said, okay, well, let's meet at church before church starts.
Nice.
He has trouble breathing, big time, and he says, my doctor wants me to have an inhaler that's $300. I can't afford that. And what I had to explain to him is, it's not $300 a month. You have a deductible. This year's $590, and it goes towards your deductible. Once you pay that, you'll pay $40 a month for that drug. And he had no idea. He was gasping for breath as we're speaking because he couldn't afford $300 a month. And so I checked with him a couple days ago and said, did you get it? He says, I'm good.
Oh, good.
Yeah, but people think, okay, I can't afford $300 a month, and they think it's every month for the year because the pharmacist doesn't know to tell them, or they simply didn't understand. Because the pharmacist is like me, they say this stuff 500 times a day, but it's new to him. And so when I explained that you had a deductible, you're not going to pay $300 a month for the rest of the year. Get the stuff so you can breathe, because that's more important. I did. I'm like, stop it.
Boy, and I'm telling you, those cancer drugs, they can be incredibly expensive.
Mhm.
you know.
So let's talk about that. Cancer drugs. So some are under Part B and some are under Part D. So let's say you're on the left side of the page, you have that Medigap plan. Let's say you have the Plan F or the Plan G. If it's physician administered, now there are exceptions to every rule, but generally speaking, if it's physician administered, it's under Part B as in boy.
Okay.
Which means if you have the F, you're 100% covered. If you have the G, once that $257 is paid, it's 100% covered. If you have a Medicare Advantage plan, then, well, let me go back. If it's a prescription you get at the pharmacy, it's under Part D as in David, generally speaking. So physician administered, who gives it to you? How do you get it? How do you receive it? Now, some chemo pills are pills and you get it at the pharmacy. That's an exception. It might be under D and it might be under B. And so that would be almost a manufacturer call. But if you have a choice between physicians saying, you want me to give that to you here or do you just want to take it home? The answer needs to be, let me have it here.
Okay.
Because that's physician administered under Part B as in boy, generally speaking. Same within the hospital. If you have any prescriptions in the hospital, it's under Part A and B. And so that matters, yeah.
I had an absolute fit. I was working for Mark Twain, and after the Butte fire, coughing and sneezing blood, right? Because I worked the fire, during the fire. They give me, while I was in, they gave me an inhaler. When I left, they took my inhaler back.
Oh, for God's sake.
Because they say that they are not a dispensing pharmacy, and they have to take it back by law.
Yeah, that's awful.
$75 inhaler.
And they had to throw it away.
Yeah, no, they had to throw it. So I'm saying,
That's the worst part about it. Yeah,
Throw it to me.
yeah.
You know,
Let me have a little liner.
if you're dirt poor, you're okay, and if you're rich, you're okay,
Right.
and then if you're here, you're screwed. What do you think of about that Mark Cuban's online pharmacy?
I don't know anything about it. Just like Walmart has a pharmacy, Amazon has a pharmacy. Those are not Walmart, Amazon and Mark Cuban and anyone else. Well, so forget about Costco for CVS for a second. Costco and CVS and Walgreens and Walmart, they're online. They're on Medicare.gov, associated with, they're not insurance companies. They dispense the prescriptions.
And they have them in their locations as well as online.
Yeah, yeah.
Okay.
But I can see all of that pricing on Medicare.gov.
Right.
I cannot see Mark Cuban. I cannot see Amazon because they don't tell Medicare.gov what their prices are.
Well,
So I can't encourage or promote them at all because I have no idea.
Right. Mark Cuban, and I'm curious about this. I mean, I have coverage, so it doesn't, you know. But being Lifeline, a lot of my, I do a lot of networking. A lot of my clients, you know, talk to me, and Big Mouth here keeps saying after an hour, I gotta go now. I really gotta go now. But Mark Cuban came out on TV, and he has a program where it's his cost plus 10%, or something like that, and that's it. Whatever the drug costs him, he only adds enough to cover his operating costs, and that's it. And I thought, I have to check this out, because for a lot of your ABCD drugs, that would save you a lot of money. Then you could have money for the expensive drugs, hopefully.
Don't know. Same with Canadian drug, pharmacies. I can't see them on Medicare.gov. And so, yeah, if knock your socks off if you want to go check it out. Just like the Food and Drug Administration isn't going to promote Cuban or Canadian pharmacies because they're not under our strict requirements. And
They
so,
might get, 1,000% tariff?
yeah, who knows? I don't know. But there are options and people can do the research. I just encourage everyone to go to Medicare.gov.
Yeah.
Well, I am hopeful that the $11.
So I would love to be able to help anyone here who knows someone who is losing their plan, who is freaking out. It's not time to freak out. It's just time to pay attention and call someone that you trust. And so that's what I'm here for. I'd love to be able to help you guys. My phone number, my office line is 209-786-2021. I have an assistant, and so she'll return calls if necessary, or if she doesn't get to speak to you. I do appointments on my calendar of digital, and so we can send you a calendar link if you'd like to come see me, or just chat on the phone for 15 minutes. But I'd love to be able to help you.